let's dive into some topics. All right, you guys have heard of the vampire facial?
Mm-hmm. Yeah, I saw it on
the
gram. I saw
the article?
News, yeah.
You know, I have to tell you, I mean, I know just enough, or I knew just enough about vampire facials to be dangerous. I basically knew it was like PRP, but actually...
What is PRP?
Platelet-rich plasma.
Oh.
I'm going to tell you all about it. So last week, the CDC reported that 3 women in New Mexico were diagnosed with HIV that they got from getting vampire facials. And that's pretty crazy because this is the first documented case of somebody getting a bloodborne illness like HIV from a aesthetic type treatment.
Yeah.
And so it's kind of a big deal. And I'm sure that you guys are probably pretty familiar with vampire facials. I guess, are you? I mean,
I know about them from, I think, the Kardashians.
Yeah, right, yes.
Promoting it.
So Kim Kardashian was big on promoting vampire facials. So for those who don't know what a vampire facial is, basically that is a aesthetic procedure where they draw your own blood out, and they take your blood and they put it in vials and they spin it in a centrifuge. And what the centrifuge does is it separates out the red blood cells from the plasma, which has the platelets in it. So that's why they call it platelet-rich plasma. And so once the blood is separated out, then they pull out the platelet-rich plasma, and then they inject it into your face.
What is it supposed to do?
That's a great question. It's supposed to rejuvenate your skin by improving the overall skin quality, thickness, and texture, and to decrease wrinkles and pores.
And does it work really well, or is it just something like?
Yeah. So I'll tell you, this is my first deep dive into vampire facials because as a plastic surgeon, I see like articles that are written by plastic surgeons and other doctors, and they've always been kind of looked down on these a little bit. That they there's not like any good data on them, and that it's maybe a lot of hocus pocus. So I actually started looking for studies on vampire facials, and I have to admit that the data is pretty sparse.
Yeah.
Because I was looking for, okay, I want to compare this to, like a placebo or compare it to like a laser. Like, where does this thing stand? Because it is kind of pricey. So if you're going to get this, you're supposed to get 3 treatments, and 3 treatments is going to run you somewhere between $1,500 and $2,000. So there's some, and that of course depends on where you live.
Yeah.
I mean, it might be cheaper some places. So I did find one study, and I actually I got a picture of it there. So this is from the Experimental and Therapeutic Medical Journal. So, I mean, not to like diss this journal, but I mean, I would rather see something from like either Plastic Surgery Journal or, maybe dermatology. So this is, I'm not going to give grief this journal a lot, but I mean, this is not like a well-known journal.
Right.
So I actually read this article, and it's the effects of autologous platelet-rich plasma injections on facial skin rejuvenation, which is exactly what I wanted to learn about. And according to this study, and I actually read the study, I looked at what they were looking at. They were looking at like microscope samples of the skin, as well as taking pictures. And they came to the conclusion that it actually helped. However, there was a couple things about the study that was kind of like, well, one, it only had 30 patients, which, I mean, that's a pretty small study. I mean, it doesn't mean that the data is, worthless, but you like to see a little bit bigger study. But like the thing that really kind of got me is they actually had the pictures of what they were rating. And so that picture up, Charles, I don't know, you guys might be able to see this. So what they did is they injected the PRP in one side of the face and didn't inject it in the other, and then they compared them. And if I remember correctly, the right side is the one that they injected the PRP, and the left side was the one they did not. And I looked at that picture pretty hard. And so what it is, it's like week 1, 2, 3, 4, or maybe it's 1, 2, 4, 6. I can't quite see it up there. I didn't see a huge difference in that. Maybe there's a little bit of a difference, but I tell you, I looked at their results and I was like, I don't know. But
I can't see anything.
Yeah, and plus, I mean, this is something you'd probably have to blow it up and zoom in on it. I'll tell you, the research paper does say that it helped, and they looked at more than just this picture. But I do agree now with kind of the consensus that the data on this is a little bit sparse.
Yeah.
You know, the treatments that we use in my office, like there's years and years of like really good data on it. And that's why I ended up going with those different treatments versus something like this. But anyway, so vampire facial, basically they take your own blood, they spin it, they get the platelet-rich plasma, they inject it in your face, and it's allegedly supposed to improve your skin quality, decrease wrinkles, decrease your pores, so on and so forth. Allegedly. Reportedly. So anyway, back to this event. So this actually happened in 2018. So in 2018, this woman in New Mexico, Albuquerque area, got HIV, and she had like no risk factors. I think she was like, you know, she was either single and not sexually active, not drug user, never had a blood transfusion. So when she came down with this HIV, they were like, okay, well, what have you been doing lately?
Yeah, what have you been doing with needles lately?
Right, and so she's like, oh, well, I got a vampire facial. Well, this was at the VIP spa in Albuquerque, New Mexico. And so the health department launched this an investigation about this. And when they got to the spa, apparently it was just
nasty.
Yeah, it was unlicensed.
Yeah, I actually read the article that they made, but it was like a social media article, so it wasn't like
it wasn't super detailed. Yeah, I pulled a bunch to try to get as much data as I could.
Yeah, but I read that it was like super gross.
Yep.
The refrigerator that was keeping
like
blood.
Food and blood in it.
Yeah.
And like so there was two important things that they found that kind of is the likely cause for, because so some people may not have any idea how this lady got HIV. Well,
wasn't it like the needles were like unclean?
They were reusing them.
Yeah.
Yeah, so they had one-time use needles that they were reusing probably from patient to patient.
Gross.
And they also had blood vials that were unmarked, which meant that they potentially were giving the wrong blood to, they were giving somebody blood that wasn't theirs.
Ugh.
So yeah, it was a real disaster. And the person that was the owner / person doing them was like not a licensed, provider. So obviously this was kind of an illegal, outfit. And
it's like you wonder what goes through people's brains.
I know, how do you feel like that you're gonna pull that off? Yeah.
It's like they must have no empathy for any person.
Yeah, right. I mean, because that's just like gross negligence. I mean, just beyond.
It's straight up rude, is what it is.
You are so rude, sir.
How are you gonna
freaking
put like somebody else's blood in somebody?
And reusing needles.
And
I mean,
be
just
okay with that, like
just
sleep
like,
at night.
And it's like so crazy because it's not like needles are expensive. I mean, we buy needles all the time because we run a med spa.
Well, I mean, they can't
they're
be
dirt
super
cheap.
expensive. They're disposable.
Yeah, I mean they're dirt cheap. It's like a penny for a needle or 2 pennies. Like it's like so cheap. But yeah, they just really were not following any type of safety protocols whatsoever. I mean, it's almost like they really had no idea what they were doing. And so unfortunately, once they figured out what had happened, then they started like tracking down all of the patients who'd gotten these vampire facials at this particular med spa. And 2 more people after that initial person came down with HIV.
I'm surprised it's only 3 if they were doing all that crap.
Yeah, well, I mean, the thing is you'd have to have somebody that had HIV come
first,
in,
yeah.
right? Because I mean, most of the time, if I gave you my blood or vice versa, I mean, obviously we would reject the blood, but I mean, if we are clean, which I assume we are, like nothing would happen, nothing bad would happen. So you'd have to have somebody with HIV come in, then they'd have to you either use that contaminated needle or their contaminated blood and give it to the next person. And sometimes, you can get exposed. I was exposed, this is like really crazy. I was exposed to hepatitis C like 5 or 6 years ago. I was doing a trauma case and I stuck myself with a needle.
I thought that was scary.
Yeah, well, so, honestly, it happens way more commonly than you think. If you're a surgeon, I mean, I probably get stuck by a needle once or twice a year. Now, the good news is actually 100% of the times it's a solid needle.
Yeah.
It's much worse to get stuck with a hypodermic needle because the hypodermic needles hold a lot more blood in them.
What is the hypodermic needle used for? Like
for injecting stuff.
Oh, okay.
See, I stick myself with sewing needles. Sewing needles are solid, right?
Sense.
There's no reason for anything to flow through a sewing needle.
Okay.
But a hypodermic needle is when you give injections
vaccines,
with vaccines or IV drug medications, that kind of stuff. So I've been stuck a lot of times with solid needles, and when that happens, we just say, okay, surgeon got stuck, and then they just run a test of that person to make sure that they don't have anything. So that happened to me, I guess 5 or 6 years ago, and the patient had pretty bad hepatitis C, and he didn't know he had it. And so, I had to take all these, do all these tests and stuff to make sure and I didn't get it, which was obviously a good thing.
Yeah.
But anyway, my point in that story is that just because someone's exposed doesn't necessarily mean they get it.
Yeah.
So I mean, who knows how many people were exposed and didn't get it?
But I wonder, so like if you go to like a licensed place that does that, I wonder if they make it to where you have to you have to be tested to
I doubt. No, there's no way.
Really?
Well, no, because you're getting your own blood back, right? So
Yeah.
it's like, I'm taking your blood, I'm spinning it, I'm collecting the stuff I want to inject, and I inject it in you, and then everything goes in the trash.
That makes
so
sense.
if you had HIV, well, so what?
Well, your blood should be handled like a
right, yeah,
contaminated thing.
Yeah.
Anyways.
Well, and it's the same thing in any med spa, even if they're not doing vampire facials, because there's needles and stuff that are potential contaminants, right?
Yeah.
So yes, you have to have some knowledge of, sterile procedure.
You treat everybody like they could.
Right. Yeah. Absolutely. Yeah. It's just like it's like
each other
a needle's
sick.
like a gun, right? You treat it like it's loaded because you never know what somebody may have.
Yeah.
So 3 people ended up getting HIV from this VIP spa in Albuquerque. It was shut down immediately. Once the health department came there, they actually shut it down in 2018 because of all of the just gross violations that they had. And the guy ended up going to jail. The owner, he got 4 years in prison, which I don't know. I think that's kind of light for giving 3 people HIV personally.
I would say 4 years for each of them.
Yeah, I thought
each
that was
person he
pretty
gave
wild.
HIV to.
Yeah, well, yeah, that's a life-changing diagnosis. I mean, fortunately now HIV is, most people die with it, not from it, because the drugs are so good. But I mean, you don't want to be on drugs the rest of your life. I mean, that's not good. So pretty crazy story. And so obviously with these things, we always, talk about, okay, well, what can we learn from this?
Yeah.
How can you possibly prevent this from happening? I'll tell you, this one's kind of a tough one because I assume this place was set up like, any other med spa. I'm sure they had a good website. I'm sure on the website it probably said that they were, fully vested in all this, right? That's a tough one. I mean, you'd have to, as a patient, really be cognizant of your surroundings to know what's appropriate or what's not.
Is there a license for vampire facials, or is there just a license for
just for doing medical treatments? Yeah. And then the thing is, it varies state to state.
Is that what it's called?
What
for in Texas, if somebody's wants
so you have to be a
it,
licensed injector, you can be a nurse injector or a licensed esthetician.
Okay.
But the laws they vary a lot from state to state, and a lot of the laws are super loose.
Okay.
I mean, there's people injecting, here in Dallas-Fort Worth that,
should not be.
Probably not. I mean, because, what they'll end up doing is someone will go and do a course, and then their friend who's, a family practice doctor is their medical director, and that person may not really know anything at all about these treatments. I mean, that happens all the time. Remember that one med spa that got shut down because they gave TPN to somebody for an IV therapy and it killed him?
Yes.
I mean, the person running that was an anesthesiologist. I mean, they don't know anything about aesthetic, zero.
Yeah.
They'd have to learn it fresh. I mean, really, I guess one way you could prevent this is, make sure if you're going to go to a medical spa that the medical director is somebody who knows what they're doing.
Yeah.
Preferably plastic surgeon, dermatology.
They're not a family doctor.
Yeah, and I don't want to say that because, I mean, I'm sure that there probably is family doctors out there that are well versed in these things. But, I mean, there's definitely a difference between, plastic surgeons and dermatologists who, they would be considered the experts on these type of things. And, an internal medicine doctor or pathologist, some doctor that has really no background in this, I think your chances of running into trouble would be higher.
Right.
So, it's kind of scary because I tried to find some pictures of this place. I couldn't really get anything that was decent, but I would imagine that this place probably looked pretty legit.
Pretty good catfish med spa.
Yeah, I mean, you would think. I mean, people were going there, and so, it probably had a pretty legit front to it. But in reality, they were just really not following regulations whatsoever. Yeah. So scary stuff. But yeah.
So creepy.
Vampire facials. Some of the girls in my office wanted to start doing vampire facials, and I was like, maybe. I mean, I just don't know if that, you know, I don't want to like do any treatment where.
I feel like it's just, to me, it sounds like something that rich people do just because. That's what it sounds like.
Maybe so, I don't know.
Like they're like, I think I'll get blood in my face, my own blood. But
yeah, right.
I'm just gonna shoot some blood.
I
in my
mean, you
face.
know, there's some data out there that shows that PRP, so platelet-rich plasma, has some beneficial effects.
It can help.
It can have some beneficial effects, yeah.
Allegedly.
Allegedly. So, I'm not sold on it personally. I wouldn't do it. You know, if somebody said I'll give you a free vampire facial, I'll be like, nah.
So if it's like do a vampire facial or do one of my laser treatments.
Yeah, I'm gonna do a laser all the time. 100%.
So yeah, there you go. There's no point to them.
I don't know. I mean, I'm not gonna totally poo-poo it, but like I'm very skeptical.
You wouldn't do it.
I wouldn't do it. And if my wife said she was
yeah.
gonna go do it, I'd be like, I guess. I mean,
Are you doing this because you just want to?
yeah.
Yeah.
You said too much money.
Yeah. Let's use it somewhere else.
All right. Interesting stuff. All right. Well, let me know what you think about the vampire facial. If you've had a vampire facial, leave a comment. Let me know. Did you like it? Did it actually work? I mean, I don't know if I've met somebody that's had a vampire facial, so you'd be teaching me. So